Maternal health is all about a woman's well-being during pregnancy, childbirth, and the period that follows after birth. Each phase should be a joyful journey, paving the way for mothers and their babies to thrive and reach optimum health and happiness. Despite advancements in the past 20 years, the number of women who sadly lost their lives during or after childbirth in 2020 was about 287,000. This figure is regrettably high and rather alarming. The primary causes of maternal injury and mortality generally include severe blood loss, infections, hypertension, unsafe abortion procedures, and complications during labor. Indirect factors such as anemia, malaria, and heart disease also play a part. Most of these tragic maternal deaths could be avoided with timely intervention from a capable medical expert in an encouraging setting. Putting a stop to such avoidable maternal deaths should continue to be a priority on the worldwide agenda. However, mere survival through childbirth and pregnancy must not be considered the only gauge of effective maternal health care. It's absolutely crucial to step up initiatives aimed at reducing maternal injuries and disabilities to enhance their overall health and well-being. Here are some essential factors related to maternal health and pregnancy. The majority of deaths among pregnant women are entirely avoidable. For example, recently, around 295,000 women lost their lives due to complications during pregnancy or delivery. This large number consists mostly of victims of severe hemorrhaging, infection, high blood pressure during pregnancy, obstructed labor, and harmful abortions, problems that can often be easily solved, and the effect of these tragic losses is felt deeply by their families. Infants left motherless face a significantly higher risk of not making it to their second birthday. However, the good news is that we're making progress. We're seeing a decrease in the worldwide maternal death rates, from 342 per 100,000 births in 2000 to 211 per 100,000 in 2021. The tide is turning as more and more women gain access to family planning and have professional help during childbirth, including emergency obstetric care. Some nations have even cut their maternal mortality rates in half within only 10 years. Yet, we must press on. High maternal mortality numbers continue to plague poorer communities especially. Out of the hundreds of thousands of maternal deaths in 2017, around 86% occurred in sub-Saharan Africa and Southern Asia. Advocating for maternal survival isn't only about human rights but also a matter of development. The International Conference on Population and Development and the Millennium Development Goals strived for a 75% reduction in maternal mortality from 1990 to 2015. This goal is yet to be fulfilled. The Sustainable Development Goals or Global Goals aim for only 70 deaths per 100,000 births globally by 2030. For individual countries, the goal is to not exceed 140 deaths per 100,000 births by 2030. Unfortunately, several South Asian and many sub-Saharan African countries are lagging behind. To hit these ambitious targets, it is pivotal to make sure every woman can access contraception, has skilled help during childbirth, and has quality emergency obstetric care if complications arise. Prenatal care is pivotal in the fundamental health care for expecting mothers. The globally respected World Health Organization, WHO, advises future mothers to have no less than 8 prenatal care meetings. These appointments allow healthcare professionals to keep a close eye on any health concerns like insufficient weight, anemia, high blood pressure, or infections and keep track of the baby's well-being. During these sessions, women are educated about food choices and sanitation practices to boost their health before and after childbirth. Both AFFPA and WHO advocate for preparing a birth and emergency readiness scheme, a vital part of prenatal care, which outlines how to access care and what to do if an emergency arises. These appointments are often a woman's initial contact with the healthcare system, offering a chance to evaluate her overall health and have a discussion about her sexual and reproductive health and rights. Women can get guidance about choosing a suitable modern contraceptive method, gain knowledge about the health advantages of birth spacing, and understand how to plan their families. They also receive advice on caring for newborns, postnatal family planning, and birth registration. Even though the vast majority of pregnancy-related complications are unpredictable and can occur without warning, even among healthy women, prenatal visits help detect and address some of these potential issues promptly. Women who attend prenatal care appointments are more likely to have their delivery overseen by a skilled birth professional who is trained to identify and manage these issues. Having skilled attendants for birth and access to emergency services is considered the key factor in ensuring safe motherhood. Skilled birth attendants, which include doctors, nurses, or midwives, are trained to handle normal deliveries and spot the signs of complications. They carry out crucial interventions, initiate treatments, manage certain complications, and supervise redirecting more serious complications to emergency care. They also play an essential role in safeguarding the health of newborns, as a majority of deaths around the time of birth happen either during delivery or in the first 48 hours afterward. Skilled attendance calls for a supportive environment. This includes a clean birthing area stocked with the necessary supplies and equipment. Furthermore, skilled birth attendants have to provide care that respects and upholds the dignity of the pregnant woman. Regrettably, many nations face a severe lack of health providers trained in midwifery skills. Urgent maternal care is essential in decreasing the number of mothers who lose their lives during childbirth. The top 5 main reasons for maternal death: excessive bleeding, infection, unsafe termination of pregnancy, high blood pressure disorders, and blocked labor, can all be managed in a health center that's adequately staffed and equipped. In such places, most newborn babies suffering from lack of oxygen or infection can also be successfully treated and saved. When complications arise, every woman and newborn must have speedy access to emergency maternal care centers that comply with high standards of care. In the long run, every birth should take place in suitable facilities, as has been the case in all nations that have achieved a notable drop in their maternal death rates. Afterbirth care, which is offered right after delivery, on the 3rd day, and then in the 2nd and 6th weeks, is just as crucial as prenatal care. Conditions like heavy bleeding, infection, and high blood pressure disorders can happen once a woman has left the health center. Newborns are also extremely susceptible in the period immediately following birth. Each pregnancy and childbirth is special in its own way. Addressing disparities that affect health outcomes, particularly sexual and reproductive health, throughout their maternity journey is important. That's a wrap. We hope you liked the video. Do not forget to subscribe to our channel for more informative content on health and wellness. Take care of yourself, and stay healthy.